Hi guys. Now, lots of you have scared of going through with an application, and the feedback that we've had is people are put off because they don't know what questions are going to be asked on a medical application. So what I thought, and because of your feedback, I will record doing an application. Wish me luck because I am not techy at all. But I just thought it'd help reassure you guys, let you know that there's not scary questions on there. It is quite easy and a simple application, can't speak, and it definitely will not affect your credit file. A lot of people actually think it will affect the credit rating. Doesn't touch it at all, so please don't worry about that. But I just want to reassure you that it is an easy process, and here are some of the questions. Now, this is just from one of the providers, so they do vary across the network, but this just gives you an idea on what sort of things they will be asking for. So let's hope that this works. So the first set of questions really are just your lifestyle. Now, we've already submitted in the quotation, which shows you how much sum assured, how long it's going to be, and how much it's going to cost as well. You've already agreed to that. You want to proceed. You were happy with what we actually recommended for you. Then we put in the basic information in regards to your name, address, your email address, telephone number, just so that we can send you a copy of the application and all of the details that we have submitted on your behalf. That again just reassures you that this is what we have submitted for you. So please check it. It is so important that this information is right for you on a medical application. So here goes. Basic information first, height and weight. So how tall are you and how much do you weigh? So we're just going to put that on here. Now you all know my height and weight, but I don't care. Sharing's caring. So UK dress size, skirt size. Have I ever smoked? No, I haven't. So to be claiming on this section, you have to make sure you haven't had any nicotine products, e-cigarettes, or anything that contains nicotine for a 12-month period. If you have, we then would have to class you as a smoker. So that's that side. Now, have you ever smoked? So I have never smoked. If you were an ex-smoker, we'd then bob in there when that was. If it is within 12 months, again, we'd have to change it. But if it was after that, we're all right. How many alcohol units do we drink per week? So I'm going to put approximate in here of 20 units per week. That varies for every different people, and some people don't even drink. Now, have you ever been medically advised to reduce alcohol consumption? So no. And please tick any of the following that applies to you. So have you been disqualified from driving in the last 5 years due to alcohol or drug use? Or do you ride a motorbike, scooter or moped on the road? Again, to me, this is none of them. Have you taken any recreational drugs within the last 10 years? So again, examples are ecstasy, cannabis, cocaine, heroin. We do need to know that on a medical application. And do you take part in any hazardous pursuits? So really anything like flying, motor car racing, motorcycle sports, mountaineering, rock climbing, powerboat racing, caving or potholing, diving, sailing, horse riding other than private hacking, professional sports, martial arts, any extreme sports. Been doing this now for over 12 years, and today has been the first time that I've had somebody answer that question, and they were sailing, but they're a sailing instructor. Now, I don't know, some of the questions might lead to other things that may cause exclusions or an increase in premiums, but I will advise all that before I've even got to the application stage. So again, please don't worry. So we'll proceed on to the first set of questions. So these, just ignore these. This is if you are working or manual work or driving, just including your job. Again, that doesn't happen in my job. And have you taken part in any of these hazardous duties whilst working? So working at heights over 40 foot, armed forces, territorial army, any oil or gas platform work, working on a fishing vessel at sea. So all the other things, they just want to check in regards to your application. Have you lived, worked or travelled outside of the UK? Ignore your holidays. This is just work-related questions. So that again, that is no for myself. Now, first set of questions are just your general health. Have you ever had? So have you ever had any cancer, tumour, lymphoma, leukemia or any growth or cyst of either the brain or spine? So no. Any heart disease or disorder of the circulatory disease or diabetes? Again, doing this over 12 years, and that is one word I really struggle on. It used to be cardiomyopathy. That is the still one I get stuck on, but at least we have a giggle whilst we're doing the application. A stroke, brain hemorrhage, or surgery to the blood vessels in the brain or neck. Any multiple sclerosis or been diagnosed with any neurological disorders. And any mental health issue that has required hospital treatment, referral to a specialist, or have you ever considered or attempted self-harm? A lot of people think that question relates to anxiety, depression, stress. Now, within this section, this is just the extreme side of the mental health that we need to disclose. The anxiety, depression, and other mental health conditions we can disclose on the other section. So PTSD, postnatal, bipolar, and lots of other conditions. And again, we will help you through the application to advise the right section to disclose information on. Any positive tests for HIV, AIDS, hepatitis B or C, or waiting for any results as such. So that's the first set of questions. So next, it's within the last 5 years only. So apart from anything you've already told us about, during the last 5 years, have you had or any of the current following? So raised blood pressure, raised cholesterol or chest pain? Any anxiety, depression, stress or mental health issues? Any form of numbness, pins and needles, tremor, change in skin sensation, tingling, muscle weakness, loss or reduction of power of limbs, including amputation, difficulty with coordination, or persistent tiredness or fatigue. Now, any form of joint pain, so arthritis of the neck, back, spine, or muscle pain or stiffness. Any condition affecting your ears or hearing, or your eyes or vision that is not corrected by spectacles or lenses. And any tumour, lump, cyst, polyp, growth, or a mole or freckle that has changed, bled, and become different in appearance or become painful. Any asthma, bronchitis, or any other condition affecting your lungs or breathing. Any stomach, digestive system, bowel, liver, or blood disorder. And any disorder of the kidney, bladder, prostate, or thyroid. Now, the next set of questions, the last set of questions mainly, are within the last 3 years only. So apart from anything you've already told us about, within the last 3 years, have you been prescribed any medication or treatment regularly for 4 consecutive weeks or more, or been under a review from a doctor or a medical practitioner? Have you been referred to a specialist or been advised to have any tests or investigations? So if you can see down the side, it just gives examples, and we would normally read these out in an application, just because if you are unsure, this will confirm whether you have had any blood tests or ultrasounds, because believe it or not, we do forget, and it's so important that we have the right information on the applications for you. Now, in addition to that, do you have any symptoms to which you need to seek medical advice for, or are you awaiting any referrals, investigations, or tests, treatment, or anything like that? Now, this is something we come across quite a lot. Clients are having test investigations for current ongoing things that they've only just found out. That sometimes can place a policy on hold, but again, we will advise you on that and take further information, and then we'll go away and email the underwriter. We usually copy you guys in, so you have full acknowledgement and authorization on what we are saying on your behalf. And this just really keeps you in the loop for everything that we're doing for you to get a decision, but make sure it's all right for you so it pays out for your family. Now, regardless of anything you've already told us about, have you tested positive for the coronavirus within the last month? So been advised to self-isolate, you've got a new continuous cough or high temperature, loss of taste or smell, or none of the above. Now, on these applications, if you do answer yes to any of these questions, it will throw up additional questions. So it is an easy, interactive system that helps give you a decision rather than just going for a GP report. So it helps speed up the process. So depending on the provider, we should be able to get you a decision there and then. If not, when we've already sent you the options through the post, through email, that will give you an indication on what the possible terms are for you guys. But we will, again, we'll guide you all through that. Now, the last question is about your family. So to the best of your knowledge, have any of your parents, brothers and sisters only ever been diagnosed or passed away from any of the following before the age of 60? So any heart attack or angina, stroke, diabetes, cancer, leukemia, lymphoma, multiple sclerosis, Huntington's disease, cardiomyopathy, polycystic kidney disease, muscular dystrophy, motor neuron disease, Alzheimer's or Parkinson's, hemochromatosis, any familial colon polyps, or any other disorder which runs in your family to which you've received or been advised to be screened for, or none of the above. Again, if you do answer any of these, we will have asked this initially in the first call, and you will know whether or not there is any exclusions or a possible rating based on the family history. Now, that is just on this section before the age of 60. Some insurers ask under the age of 65. So this then is the last screen. So no more questions. That is everything. So that just shows you how easy it is to go through with an application. It will tell you whether it's standard terms. So that means that has all been accepted. There's no increase in premiums. There's no exclusions. If it comes up and it is non-standard terms, that means that there's possible exclusions or there is an increase in premiums, which we call rated. That just means that premiums have increased because you are at a higher risk due to your medical disclosures. Now, again, you will know about that before we get to this section. And if we do, this section will let me adjust the cover where then, if needed, if the premium is too high, we can then lower the cover as discussed to help reduce the premiums for you. So again, please do not worry. We will make sure that we can find the best cover suitable for you guys, and we will always keep you updated along the way so you know about everything. So that's it. That is a quick, easy application. They're the questions. They would then repeat for any of your partners. There's no questions for children. They're automatically accepted on the policy if they are financially dependent on you guys as the adults. But again, we try and just keep it easy, keep it simple. And I just want you guys to be reassured that we are here to help you and give you the full understanding on the whole process. No credit checks are done with these insurances, which is brought up quite a lot, and it is a very simple process. So any questions, please do give us a message. I am now going to try and download this video and get it on social media so that it helps answer any of the questions that you guys have got. So thanks for listening. Hope this has helped, and don't forget to cover your bubble.